Hi, I'm Dr. Helen Liebling. I'm a clinical psychologist. I work for Coventry University and in the health service, and I've been carrying out research on survivors of sexual and gender-based violence in Africa since 1998, together with African organisations. And I want to tell you today about a project we carried out recently in eastern Congo. And this project focused on the health and justice responses to women and girls who'd become pregnant through rape. And this was identified as an important research area and a neglected area. And it was identified by the World Health Organization's Sexual Violence Research Initiative as a gap in our current knowledge. So we managed to get funding from the British Academy, and we worked together with a local Congolese organisation called the Institute of Mental Health in Goma, and also in Bweramana, a rural area, to carry out our interviews. And our interviews recruited volunteer women and girls, and that was really important that they were volunteers and wanted to come to speak to us. And we also worked through the Institute with local women's groups and church organisations where they already had women and girls groups meeting. And that was an important source of support for the women and girls whilst carrying out a sensitive research area. And so a choice was given to come to individual interviews or focus groups. We got all the ethical clearance from both countries in the UK and Congo, and what we found was that impunity and gender inequality was fueling sexual violence, not only in the conflict areas, but also it was contaminating the domestic sphere and the communities. And most of the girls were being raped by community members, not rebels. And also this was causing a serious psychological and reproductive health problem. So the girls that we interviewed were very suicidal, and there were conflicting emotions about the child, which was a constant reminder of the rape and severe social rejection from the community, but also that they wanted to love a child who was innocent. So dealing with those conflicting emotions was very difficult for these young girls that we interviewed. And in terms of the next steps, we made various recommendations and policy recommendations, and we met together in Goma with all our participants and key informants. And some of those recommendations included joining up health and justice responses to a more holistic services for women and girls who become pregnant from rape. This is very important because sexual violence and becoming pregnant from rape is a violation of a woman and girl's body, and it's also a violation of her right. So it's important these sectors are joined up. But we also made recommendations about trying to decrease the stigma and shame within the communities by working closely with community organisations. Because if these girls and women were accepted and not rejected from the community, it would make a major difference. So we disseminated these policy recommendations through a UNICEF thematic global debate, and also we're following up with our local partners to what extent the recommendations are going to be implemented. Also with UN Women, we hope they will take our idea of offering mobile clinic services using a holistic model to the rural areas. So I thank you very much for listening.